Dr. Stella, what are the earliest signs of osteoarthritis in the cats and dogs that vets often miss?
The early signs are usually first seen at home, and the first who identify the problem are the owners, and they're the ones that we collect information from the history that something has changed with my dog. Is a little bit more stiff in the mornings. It takes time for them to start walking normally. The vets usually they miss the osteoarthritis because a proper orthopedic diagnosis is the key here. Usually we accept the dogs or the cats directly in the consultation room without observing them how they walk inside the waiting room, inside the clinic is very, very important. The first signs start from the waiting room, and of course by collecting as much more information we can from the owners, who are the ones that they first identify the changes in the behavior and the gait of the dog. Then we miss the osteoarthritis because we don't have a very accurate diagnosis on the cause that caused the osteoarthritis.
Why osteoarthritis is still very undiagnosed, especially in cats?
Especially in cats, that's a very correct actually question, because cats, they hide their pain. They don't show signs of pain in general, not only for osteoarthritis. Usually, again, it's the owner who first recognizes the change in the behavior, about the litter habits or how the cat is moving inside the house, going on the stairways up and down. So this is the first thing, and then the vet is the second person, okay, to identify the osteoarthritis issues with the correct orthopedic exam. Again, it's all about the orthopedic examination and collecting a very detailed history from the owner. That's why there is some pain score sheets, let's say, that we have already prepared for the owners to complete, and also the vet also can collect the points, and then we have a proper, let's say, sum up of the pain score in cats. It's not easy. It's not easy to diagnose in cats osteoarthritis.
I think we need to spread the awareness for cat owners, for them to spot the signs and communicate with the vets, because sometimes they feel stuff, but they feel that it's not very worth it to speak with the vets about, right? So they miss them.
Yeah. That's true, and that's why we have to insist in specific questions when we communicate with the owner. And again, the history for the cats, because the dogs come to the waiting room and is walking in front of everybody. With a cat, you put her on the table and she's just sitting in one position without even moving. You cannot see even the walking pattern. You have to catch her and just do the pain points to understand where the pain is coming from. So it's not easy.
So the diagnosis should rely on the pet owner, the vet?
Yes.
Some radiographic tools as well?
Of course, the next step after the history and the clinical examination is the x-rays. Okay, the x-rays will show us some signs of osteoarthritis. This is easy to identify, and then we collect all the information and we specify the treatment depending on the orthopedic conditions that can cause osteoarthritis.
And how do you usually manage an osteoarthritis case?
Initially, we start what we used to do up to now, some anti-inflammatory treatment. Okay, there are many medications in the market that we use, non-steroid anti-inflammatory drugs, when, of course, the patient allows the general health. And then weight management is very important, physiotherapy as an additional treatment. And recently, we have the new science behind osteoarthritis has shown that specific drugs, injections, have worked very well in identifying specific inflammation mediators to stop the pain pathway for both of them, for dogs and cats.
Yeah. So basically, the management is multimodal.
Exactly.
We need the diet, weight management, nutraceuticals, pain control.
Yeah.
So no one treatment will be enough.
Exactly. And we can specify, actually. There are many, we can name the products. Yes, it's the Librela and Solensia.
As an orthopedic specialist, what final advice you can give to vets watching us?
What I have to say for the vets who see every day so many animals, dogs and cats, that they might suffer from pain, and they're presented with osteoarthritis because sometimes what the owner thinks, they think that my dog is aging, maybe that's why it's like this, but behind that, it might be a very clear orthopedic condition that needs to be investigated and address it properly. Sometimes we think it's osteoarthritis, but behind that, we have to see where it is coming from. So the vets should be sure that they're doing an overall clinical examination, take x-rays without blindly, of course, rely on the x-rays, because sometimes the clinical picture is more important, not the x-rays themselves.
You mentioned aging, and here I think we should highlight that osteoarthritis is not only for pets that are aging. We can see it in as young as 2 years old in dogs and cats also. So it's
Exactly.
not 100% age related.
Exactly. It starts from a cruciate ligament problem, for example. It starts from hip dysplasia, elbow dysplasia, and because we are not always able to diagnose these issues, we let them become chronic, and then the osteoarthritis is established, and then it's very hard to reverse it and do a miracle. Thank God we have some nice products now that can help with reducing the inflammation and the pain. But of course, the weight management we do for osteoarthritis, physiotherapy, all of these things, the multimodal treatment is very important. But having in hand the initial cause that caused that can actually change the whole narrative also.
Thank you so much.
Yeah, okay, you're welcome.